All right, an update now on Pope Francis, who has been hospitalized for 13 days now for pneumonia. The Vatican press office just put out a bulletin minutes ago saying his condition has improved slightly from critical. It says his slight kidney failure has resolved and blood tests are showing improvement. He is continuing oxygen therapy and his prognosis has improved slightly. We're told he devoted his afternoon to work activities. Now, we have been seeing over the past few days people gather to pray for the Pope around the world. A special service was held today inside the chapel of the hospital today, where the Pope has been staying, and people have been gathering in Vatican City nightly. So let's bring in CBS News foreign correspondent Chris Livesay, who is live now from Rome. Chris, what can you tell us about the Pope's condition now?
Well, as you said, there's some slight improvement. Now, not to overstate it, he is still sick with not just pneumonia, but double pneumonia. And we had that scare over the weekend when they told us that he had to get high-flow oxygen. He's still getting that high-flow oxygen, but they're able to moderate the amount of oxygen that he gets. There's no more mention of blood transfusions, no more mention of pain. Those were some of the other alarming details that came out over the weekend that got all of us so ready to report on what might happen next with Pope Francis's health. But right now we're getting a different picture, one that comes with slight improvement. As you also mentioned, he's resuming some of his work activities. So it's kind of like business as usual. This is the Pope's fourth time that he's stayed at the hospital since he became Pope. Fourth time also just since 2021. So just in the last 4 years, he's been kind of a regular at the hospital. And in each of those visits, he's been able to carry out his work duties. And this is just showing that, you know, the Catholic Church is still being run by Pope Francis. Despite being sent to the hospital for double pneumonia, he's also able to get up out of bed. He's able to eat food regularly, so not through a feeding tube, not intravenously. So things are looking slightly better, keyword slightly, from this latest report from the Vatican.
That is good news. And Chris, Norah O'Donnell actually sat down with Pope Francis in May of 2024, and that interview is circulating again online right now. That's because Norah asked if the Pope, if he would ever consider resigning. Take a listen to that.
So you have no plans to resign or retire? I know you don't like this question.
No, la diga, sí.
Not at all. Ask all you want. It has never occurred to me. Maybe if the day comes when my health can go no further, perhaps because the only infirmity I have is my knee, and that is getting much better. But it never occurred to me.
Now, it's worth remembering that Pope Francis took office in 2013 when Pope Benedict became the first pope to actually resign from office in 600 years. He chose to step down at the age of 85 and died almost a decade later. Now, Benedict's resignation actually sparked up debate about creating new rules for future popes that might follow in his footsteps and resign if they can't continue their duties. So going back to Pope Francis, what are the next steps for the Vatican if Pope Francis is unable to perform his duties? Is there any protocol in place? Are discussions being made behind closed doors?
Well, effectively, if Pope Francis is incapable of carrying out his papal duties, then you have administrators here at the Vatican who can carry them out. I mean, it's presumed that they're already carrying some of them out for him while he's in the hospital. You have the Secretary of State and you have the Chamberlain, the first two that come to mind that would carry out those duties. And it's something to seriously consider. Pope Francis himself has talked about possibly resigning, not just in that interview with Norah O'Donnell, but I've heard him talk about it on the papal plane. But he's never said that it's something he really seriously considers. But of course, you know, he also talked about having drafted a resignation letter shortly after he became Pope in the event that he becomes incapacitated. But he's made a distinction between himself and Pope Benedict, who resigned. He certainly respected Pope Benedict, that decision that led to Pope Francis's own papacy, but every chance he's had to indicate the decision he would make given a similar circumstance, he's made it clear that he wouldn't be as quick to resign. That said, this is a very special year right now. It's a holy year. It's the year of Jubilee. There are a lot of events on his calendar. You have tens of millions of people coming from all corners of the globe not just to see Rome during the Holy Year, but to see Pope Francis himself, supposed to make dozens of public appearances. And if he can't make those appearances, many Vatican experts have been saying quite vocally that Pope Francis must be considering resignation because he would feel bad about not being able to carry out not just his papal duties, but his Jubilee duties. Liz?
Yeah, it's worth going back to our breaking news from today that the Pope's condition is improving. He still remains in critical, but that his condition is improving in hospital. Chris Livesay reporting live from Rome. Thank you so much, Chris.